Back to one of our top stories, where Singapore says that 90% of migrant workers living in dorms will be able to resume work by the end of the month. COVID-19 testing of all workers in the dormitories expected to be completed by tomorrow. Cheryl Goh joins us live. Cheryl, what does the clearance of these dormitories mean for the workers and the wider industry?
Yes, Brenda. So basically, authorities are on track to test all 300 or so workers living in the dormitories by Friday, which is tomorrow, except for a final group of workers who are currently completing their quarantine. So what this means is we can expect to see volatile case numbers as the workers continue to be tested at the end of their isolation period. So, for example, we saw around 900 cases yesterday, and the number dropped to around 300 today. So what we can expect is this situation of volatility to continue for about 2 weeks or so before the numbers finally taper off. And the task force did say that, yes, most foreign workers will be able to return to work by the end of this month. And this also means that many construction activities and projects should be able to resume soon. However, the task force was keen to stress that this is only as long as the employers make the necessary arrangements to allow workers to return to work safely, especially those that have a higher nature of risk and infection. They also urge contractors to start to put in place the necessary safe management measures right now. Now, and in terms of accommodation, housing arrangements for the workers will be slightly different, especially now that the dorms are cleared. So, co-chair task force co-chair Lawrence Wong, he did say that authorities will try to consolidate them for better management instead of having, for example, workers from one employer should be, living quite in close proximity to each other instead of dispersed across various blocks. And this will allow for better isolation of these workers in the event of an infection. And therefore, those in the same room or floor can be isolated instead of having an entire block on lockdown. They are also looking at a whole other range of safe management measures in the dorm, also at work sites, and even on the transportation that the workers are taking to and from the dorms. They will also be establishing more long-term medical care facilities to help ensure that the dorms remain relatively virus-free, and also there are protocols in place to prevent clusters from forming.
Just because we have COVID-cleared dormitories doesn't mean that we should assume these are permanently COVID-safe dormitories, because we all know that the virus can flare up again, and that's why we are putting in place safeguards, particularly to ensure that all the workers in the dormitories will still be taking routine and regular tests once every 14 days. So that process and that regime, on top of all the safe management practices that are in place, will continue.
Cheryl, what was said about the mental health of workers?
Yes, that's right, Steve. So the task force did acknowledge that there have been cases of self-harm among the workers reported over the past 2 weeks. Police have responded to a string of incidents in the dormitories where workers were apprehended apparently for attempted suicide. So they did say that they are very concerned for the mental health and well-being of these workers. And they did acknowledge and note that, being cooped up will take its toll on any individual, not just the workers, even people like, even us. So what the task force is continuing to do is to really look for ways to reach out and support them further.
There are staff that come down and encourage workers to step forward if necessary for counselling. So mental health has been a concern for that particular task force for quite a while, ever since they started work in the dormitories. This continues to be a work in progress. So I do not pretend that that work is completed, that we have a very comprehensive system of support. But the task force is committed to making sure that the mental health needs of the migrant workers are looked into.
And so what they're going to do is basically work with the Manpower Ministry to perhaps explore a sustainable framework to really have that in place to support the mental health of these migrant workers. And there are also various partners that they are going to work with across various domains, including counselors, social workers, psychiatrists, and psychologists, to see how to really better improve the support that can be provided to migrant workers in this regard. Back to you in the studio.
Thanks very much for that. Cheryl Goh speaking to us on Singapore's efforts in battling the coronavirus.